My name is Hannah, and I'm a physical therapy student at Campbell University. And today I will be demonstrating a tibiofemoral posterior joint glide. Joint glides are defined as a passive movement performed with a rhythm and a grade. In the case of mobility restrictions, normal joint rolling is disrupted and usually associated with impaired joint gliding. In this case, the tibia is unable to roll and glide appropriately during knee flexion. The effects of joint mobilizations are to stress restricted tissues in order to increase motion, may alter the pain pressure threshold, and cause neurophysiological changes. Courtney et al. Conducted a study on tibiofemoral joint mobilizations in patients with knee osteoarthritis and concluded that joint mobs result in a global increase in pain pressure threshold, enhanced pain modulation after joint mobilizations, and there was a decrease in resting knee pain. Lance et al. In the International Journal of Sports Physical Therapy performed a case study on a 20-year-old female with patellofemoral pain syndrome and tibiofemoral joint mobilizations. The mobs performed decreased her hypermobility in the affected knee and decreased her pain symptoms to allow her to return to her previous level of functional activity. The tibiofemoral posterior glide is indicated for patients with restrictions in knee flexion. So you're going to start the patient in a supine position with the knee in an open pack position, which is the position in which you have the greatest degree of mobility between the articular surfaces. So for the knee, this is 25 degrees of flexion. The patient here is having her other leg off the table for the purposes of the video so you can see. Place a bolster, wedge, or a rolled-up towel just proximal to the knee, and as the patient progresses, you'll be moving the knee into the point of greatest restriction for flexion. The therapist should stand on the side of the knee being mobilized and place a stabilizing hand on the anterior thigh, just proximal to the knee against the bolster. You're going to place the other hand on the anterior tibia, just distal to the knee, and you're going to be applying a force in the direction of the treatment plane, which here you have drawn out the femur and the tibia. So the force here is going to be applied directly into the table. You're going to perform a joint glide for 30 seconds at either 1, 2, 3, or 4, depending on the patient presentation. So we're going to be performing the glide. And again, as you perform the glide, you should be assessing for patient tolerance, asking about their pain, making sure that it's comfortable for the patient. And once it's been 30 seconds, then you can recheck their flexion degree and see if you've made any improvements. And then you continue to do the joint mobilizations if needed. So I'm going to be doing a joint mobilization to your knee. So first I want you to do is lay down on your back. Okay, and then I'm going to put this towel under your thigh right here. You're just going to hang off on the edge of the table right here so your knee's just a little bit bent. Okay? I'm going to be providing force on your lower leg to glide this bone backwards to increase the amount of mobility you have in your knee so you can bend it more. Okay. Okay? It shouldn't be painful. When we get to the restricted range, it might be uncomfortable, so you can let me know. We can adjust my hand placements if those are uncomfortable as well. Okay, so I'm going to be doing it for 30 seconds, and then we're going to check to see how much your knee bends, to see if we made an improvement. Okay. Okay? So I'm going to put one hand here and one here, and I'm just going to gently glide with this hand down. How's this feeling? Still okay? That's good. No pain? Okay. Once we get to 30 seconds, we'll relax. And then I'm just going to passively bend your knee, and hopefully we'll have made an increase in the amount your knee can bend. Okay. And then if not, we can readjust and we can do it again. All right. And that's how you do a posterior tibiofemoral joint glide.